Thank you, Ms. Sandeep and Sridhar sir. It's a nice session, but we need more participation from different parts of the India to have the more attendance. So good morning, good afternoon, and good evening. Welcome to the 974th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you. Today we have with us Dr. Gurukiran, BHMS SCPH. We all know that he needs no introduction, that much important he is now. The boy with golden hand in IFPH. He is graduated BHMS from Government Homeopathy Medical College, Bangalore, and affiliated Rajiv Gandhi University of Health Sciences. Classical homeopathy practitioner in the district of Chamarajanagar, state of Karnataka. 15 years of clinical experience, an independent researcher, post-graduation fellowship in SCPH, United Nations, presented papers in homeopathic approach for treatment of different types of cases, especially psoriasis, thyroid problems, PCOS, epilepsy, hypertension, respiratory disorders, parahemophilia, GERD, alopecia areata, infertility. Very tough topics. Then presented papers on Doordarshan Chandana in various skin disorders. The topic that is also very interesting and important, conversion of patient language into rubrics. First one, perceiving the language is very important. Then converting this language into repetitive language. That's another problem. So we all know that always translations and conversions is the main problem. We all know that the Puritan type of repertory and utilitarian type of repertory, the Herring repertory of nerve, then the sensation as if, then what, concordance repertory, all these are these Puritan type of repertories. Well, commonly used repertories are the utilitarian type. So on behalf of IFPH, I welcome Dr. Gurukiran. You can have the platform for next 40 minutes. It's over to you.
Yes, sir. Thank you very much, sir, for the warm welcome. And good morning and good evening to all the doctors and homeopathic lovers all over the world. And welcome for the today's session. Yes, today's topic is very interesting. Conversion of patient language into rubrics. Basically, in the last session, I have said that it's an art. This conversion of patient language into rubrics is an art. So how it matters to an homeopathic physician in a clinical practice? Let's see. Before that, with due respect to Dr. Samuel Hahnemann, this is a picture of Dr. Samuel Hahnemann as a treating physician. It's one of the rare pics what I have found as a treating physician. Because of him, we are all here today. A very beautiful session. Yes, many practitioners find it difficult to interpret symptoms and conditions to refer in repertory and to arrive at the minimum. This is a very basic difficult what we have faced in our clinical practice. Many of the rubrics are ambiguous, implicit, and need a continuous study. Hello? Can you hear me? Any problem?
No problem. Please continue.
Okay, fine. Many of the rubrics are ambiguous, implicit, and need a continuous study. What is ambiguous? Ambiguous is the rubric having two or more meanings to a particular word. And implicit, as we all know, which needs a continuous study. And majority of the rubrics found in the mind and other chapters are neglected by the common practitioners for want of correct understanding and interpretation of the rubrics. This point is very, very important. We know and we have studied in our BHMA classes when we are studying repertory subject. Majority of the rubrics found in the mind or other chapters are neglected when we sit in a clinical practice. This is where the problem arrives as a physician. This is where we have to convert the patient language into a rubric so that it is easier to repertorize in a repertory chart to guide the simillimum. After studying the repertory and understanding the depth of it, I realized that there are different approaches needed in every case. In every case, the main idea would be to take the case in depth, in completeness, and after case receiving, depending on the type of the case, we should be able to analyze which is the best approach to the particular case. This becomes important in a clinical prescription. You have already taken the case is complete as per your case taking performer. After that, what is the best approach which will suit to treat the present condition or the present case? This becomes very, very important. According to that, on the basis of that, we have to select the repertory or approach to the particular case for the simillimum. The fact is, we need any and every way of finding the remedy on comprehensible principles. This is very, very important. The fact we have to reach to our target, and we need every way, but not leaving the comprehensible principles or deviating the comprehensible principles, what Hahnemann has said. So what he has said in the aphorism 2, as we all know that, the highest ideal of a cure is rapid, gentle and permanent restoration of the health or removal and annihilation of the disease in its extent, whole extent, in the shortest, most reliable and the most harmless way on an easily comprehensible principles. This is very, very important. We have to find a way to reach a simillimum, to treat a case, but which should be more reliable in the shortest, most harmless way on easily comprehensible principles. This should be the modus operandi and the approach. Okay. Who is this? As we all know that, Dr. Compton Burnett. And Burnett says we need to know and have different approaches and different methods of analysis. He only says in his literatures. So it means that we should be ready with different kinds of approaches, various ideas, if you have to find a way to reach the simillimum. And different techniques. What are the different techniques? The broad physical generals and mentals, that is constitutional, peculiar characteristic symptoms, single remedy rubrics or few rubrics, generalization, and usage of specialized repertories like nerve repertories, BBCR, Boger-Bonninghausen, Clark, Roberts, Watts, special repertory, fever repertory, etc. So we should be all knowing these kind of techniques. So which is best suited to a particular case? Then we have to opt that approach. By using that through repertory as a tool, we have to crack a case and to reach the simillimum. So these are all the different techniques what we have to consider in approaching a case. So if something is striking or characteristic in the case, it must be in the remedy. This is very, very important. If such a remedy doesn't cover any aspect of the case, then one must hesitate to give the prescription. If the case presents with the clear essence, totality, keynotes, and the generals and the causation of the symptoms, it would be an ideal case. What would you call it as ideal case? This should justify all those things. So in majority of the cases, it is not the lack of knowledge of a remedy, but rather the lack of understanding of how to apply the remedy. This is where we get falter. When a mental symptom presents in a case, then it is necessary to take into consideration. When it is not present, then the use of strong homeopathic symptoms and try to find the simillimum. This is another idea. So what Dr. J.T. Kent says, he also says more than one method is needed. Once upon a time, he was abusing some keynote prescribers in his literatures. And also he says, Kent was also using keynotes. He also says keynote is very, very important to crack a case. We should also know one or more method to analyze to reach the minimum. Okay. Now, that is part 1. Now, let's move on to the part 2 now of this session. It is very, very important, which is very interesting. That is conversion. How we can convert the patient language into rubrics. Yes, what I have grasped till now, what I have attained some little knowledge on this. On the basis of this, I am presenting this today. If there is any mistakes or if there is any changes in the meaning or anything, we can discuss it later. So basically, what I have chosen for the today's session is generally what we encounter in our clinics. What the patients say, how can we convert this into rubric? There are a lot of things other than this. I have chosen it a very, very important rubrics only. See, some patients come to your clinic, especially to a homeopath, they'll come after all other treatments. So, if a patient come and sit in your clinic and says, doctor, I'm fed up with all kind of treatment. Now I have stopped everything. This has to carry very good marks. Each and every patient may say this, but the patient has to stress upon it and it should carry some weightage. Then only we can consider it into rubric, into a totality of the case. So how can we convert this statement from a patient fed up with all kinds of treatment, now stopped everything? It is disgust. See, I'll say the patient's language in the first line. Second line, which it is bold and italics, is the rubrics. The rubric is disgust. And I have attempted to give one of the main remedies for this rubric. There are other lot of remedies. Only the 3-mark remedies and the 4-mark remedies, which is in the Kent and the complete repertory, have attempted to show to you in this slides. So these are all the main remedies which comes to the rubric disgust. That is platina, pulsatilla, and sulfur. If the patient says this, we have to in a position to grasp it and convert it to rubric. I think by the end of this session, I would like to give some kind of tips and conversion language from the patients to rubrics. If the participants will something they grasp on at the end of the session, I'll be happy. Yes. Second is starts narrating his complaint spontaneously. The observation is key in our clinics. When we sit in a physician chair, the observation is very, very key in each and every case. When the patient, it's a new case, the patient enters into the cabin, he sits in front of you, starts without asking any questions, without asking anything, the patient starts narrating his complaint spontaneously. What it is, when it is converted into rubric, it is extroverted in nature. The remedies are argentum nitricum, medorinum, phosphorus, pulsatilla, bovista, lachesis, sulfur, tuberculinum. Yes, all investigations are normal. Still afraid. The patient says, sir, all the investigations are normal, sir. I'm still afraid. Can I get rid of this condition, sir? What it is? How can you convert this statement from the patient? That is hypochondriac. This patient is definitely a hypochondriac patient. So hypochondriac is a rubric. It has got some main remedies, that is aurum, ignitia, natrium, pulsatilla. I don't care about the money, but your medicine is too costly, sir. This we have encountered in our clinic. How much ever money I can give you, but after the prescription, after the consultation, sir, it has become too costly, sir. What is that? How can we convert it to rubric? That is miserly. The patient is miserly. These are all very, very important tips. We have to make it a note of it. not for the first time also, when the patient come to the follow-up also, this may help in cracking the case. That is arsenicum album. And another patient comes, he says, I feel very lonely. No one taking care of me. That is forsaken. The feeling is called as forsaken. If the patient has family members, if the patient has parents, wife, and everything, they're taking care of him also. Instead, but he says, I feel very lonely, sir. Instead of all the family members are with me, all the children are with me, and the wife is with me, but no one is taking care of me, sir. What it is? How can you convert to this language of the patient? That is forsaken feeling. The main remedies comes out is aurum, soranum, pulsatilla. Keeping a distance with social relations. Now it is easier to recognize this. How? Can somebody tell me? It will be better. I think interaction will be. It is very easier nowadays. Keeping a distance with social relations. How can we recognize this patient? Because we have got Facebook, Twitter, Instagrams, WhatsApp, all those things. The patient will be very social. If it is not, keeping a distance with social relations, what is considered as aloof? Aloof. So the main remedy comes out is platina, natrium, sepia. If the patient is not mingling with others with these kind of social media platforms, we can think of rubric, aloof. Yes, I never involve in family matters. Wife is always taken care of them. What is this? It is apathy. It doesn't involve any kind of family matters. So that is carbohydrate, ignitia, opium, pulsatilla, sepia, staphysagra. And some patient, or especially a parent says, sir, we cannot predict about his nature in anywhere, in the school or in the home. What it is? It is abrupt nature of the child. Chamomilla, acid phos, pulsatilla, tarantula, veratrum. When he gets anger, he always use bad words. While taking a case, when we are probing his anger, the patient's anger, and we should know to answer this question, does he uses bad words when he gets angry? Or you can ask, so what is the expression when the patient gets angry? How would the patient react when he gets anger? He throws the things away, or he scolds, he shouts, or he uses abusive language. That is, the rubric is abusive. When there is a striking picture in the case, when the patient or the patient's guardian says, no, sir, when he gets angry, he uses bad words every time. This is his nature. Whatever there is a complaint, then we should convert into a rubric. That is abusive. She feels bitter after treated unfairly. What is this? The patient feels very bitter after treating unfairly. Resentment. The major remedies is natrium, nitric acid, nux vomica, rustox, and sulfur. And the boy is anxious on the previous day of result. This is very common. When the PUC results comes and the 10th standard exam results comes, the boy is very anxious on the previous day of result. Some boys will be very, very happy, or there will be no care. They'll be playing, they'll be watching movies. But some boys get anxious. What it is? It is anticipation. It's a very broad rubric. We have got lot of remedies in anticipation. Aconite, arsenicum, brevenia, calcarea, chamomilla, pulsatilla, rustox, everything. So major remedies comes in anticipation. And anxiety with physical suffering such as tremor, diarrhea, and sweat. It is anguish. Angry is different. Anguish is different. Anguish is broader one. Anxiety with physical suffering such as tremor, diarrhea, and sweat. Bismuth and arsenicum album is the main remedy. Student is repeatedly asking the question in order to test the knowledge of a teacher. How can you consider this? Inquisitive. That is curiosity of negative aspect, not for the positive aspect, but for a negative aspect. That is ambra and tuberculinum. The student may be ambra or tuberculinum. Children dislike gentle advice of the parents or elderly people. This will happen some of the majority of our homes. Children dislike the gentles, especially nowadays. They do not like the advice of the parents or elderly people. That is admonition, aggravation. Admonition, aggravation. Carcinosin. Bold and overconfident. That is presumptuous. Presumptuous, that is lycopodium. Negative boldness. What it is? Audacity. Audacity is the major remedy is agaricus. Negative boldness. What we see in the Bollywood movies, heroines. It's negative boldness. A quack, a false homeopath claims the results. What it is called as? It's called as charlatan. Lycopodium is the major drug, major remedy. A quack. Intimate communication with the strangers. These are all the very peculiar symptoms. What we can hunt in a case. Intimate communication with the strangers. Is communicative. The patient is very communicative. That is lachesis and phosphorus. Can anybody tell me why the phosphorus is always associated with Ophidia groups? Like lachesis, naja, Crotalus horridus, vipera. You take any Ophidia, any snake remedy, phosphorus is always associated with that. Can I have an answer in the last session? Yes. Unnecessarily involving with other activities. That is meddlesome. Chelidonium and hyoscyamus. Child died 1 year back. Still great sorrow and thinks over it. It is brooding. This is brooding. The major remedies carbonimalis, ignitia, natrimur, rustox. No control over anger. He throws the TV, mobile, anything in the hand, etc. What it is called as? This is rage. This, when it is converted into rubric, this is rage. The major remedies are bryonia, chamomilla, hepar, lachesis, nexpomica. Child has a desire and capacity for intellectual work. What it is considered as? Intellectual children. Rubric is intellectual children. If it is in a child, children, or in adult, intellectual. The major remedies are aconite, barreta, belladonna, carcinosin, lachesis, phosphorus. And fear of contamination. This we have seen in the COVID time. Fear
Excuse
of
me, Dr.
contamination.
Gurukiran, I think you are a bit hasty. Kindly go slowly. We can have a series of sessions.
Yeah. Fine, sir.
Okay, very important topic, very interesting one. So everybody needs to noting. So
Definitely,
please,
sir. Yes. It's a lot of rubrics is there, sir. Yes. Okay.
No problem. Time is not a factor. We can have another session. No problem.
Okay, sir. No problem. Yes. This is a rubric is fear of contamination that we have experienced in the COVID time. That is called as mysophobia. The patient presents, especially in the COVID time, it is a very beautiful observation at the time. You ask the patient to come inside, they will not come. You ask the patient to sit in front of you, they will not sit. They try to enter your cabin with the force. You may think of this rubric. And also if you say, please sit down, they will not sit. It's okay, sir, no problem. Why? Sir, fear because of any contamination, especially in the COVID time. So these are all the kind of patients we can think of. We can convert it into rubric. It is mysophobia. The major remedies are arsenicum, calcarea, sulfur, thuja, carcinosin, lachesis. And also one more observation is very, very important is after your prescription, when you ask the money, they will not give the money. They will say, sir, digital payment. If you give the note, they will get contaminated. Fear of contamination. This is very, very interesting, especially in a time of COVID. They will not give you notes, currencies. Due to fear of contamination. And fear of responsibility. This we have seen in a lot of cases, especially when we think of a constitutional remedy, constitutional approach, the fear of responsibility. What it is called as? It's a wonderful rubric in our repertoire is ergasophobia. Ergasophobia, both the things can be applied. Fear of responsibility. That is, aurum, especially lycopodium, is very, very marked, and silicea. These are the major 3 remedies when we think of fear of responsibility. How can the patient say about the fear of responsibility? The patient, if you ask, do you enjoy the responsibility? Anything which you gives to you in your office or in your family or in any functions, the patient says, yes, sir. I would like to take the responsibility, but there will be always fear. Will I succeed in that or not? So this is fear of responsibility. You can also take responsibility fear in the rubric, but there is also a specific rubric in the repertoire, that is ergasophobia. And fear of sudden and extreme. What it is called as panic. That is aconite, latrodectus, sorinum, rustox, spongia. This is important. When we're taking a case, if both the couples have in front of you in the clinic, you'll ask, who is the decision maker in your family? The wife says husband, husband says wife. So on the basis of that, we have to analyze ability to make decision quickly and effectively, which has to be executed well after taking the decision. What it is called as, this is decisive. Decisive, the major remedy comes is tarantula. Also, Merxol also comes. Then we have to think after taking the totality. And cannot perform in order due to the confusion. What it is? Chaotic. He cannot perform. He cannot do anything. The patient will be under confusion. What it is called as chaotic. So the major remedies are arsenicum, belladonna, Merxol, phosphorus. The Merxol keynote is chaotic, directionless. It will be under confusion, no direction at all. The child is excessively innocent. This will happen in our clinics also. The parents come with the child and says, sir, he is very, very innocent. He doesn't know anything, sir. He's so innocent that he don't know what to do, what not to do. What it is? It is naive. This rubric is naive. This is also very, very important in our clinical practice. The major remedy is belladonna, china, stramonium, phosphorus, pulsatilla, and sulfur. You can consider the child as naive. So next we move on to this, talks about minor belongings. What it is? That is vanity. For this, I would like to share a case, which is a very, very important thing. The patient came with the symptoms of allergic rhinitis, and also I think allergic bronchitis also, sneezing due to exposure to dust, any fine dust. When the maid in the patient's house, when start to sweep in the morning, the patient gets sneezing, continuous sneezing, continuous. Sometimes also when it is neglected, when it will turn to cough also. After all the case, after taking the case, something I have observed from the patient. That is, the patient will be always talks about some minor belongings, anything it may be. What she showed was she has purchased a vanity bag, purse actually. It was folded in her hand and it was very, very expensive. She said, sir, this purse is I have given for 5,000 rupees. A small one, 5,000 rupees. I said, okay, what about this? I've asked the patient's mother. The patient mother said, no, sir, whatever her belongings in the home, also in the toilet, she has especially ordered for a specific shower, specific tap fittings. When the friends visit her house or any relatives visits the house, especially when they come to her room, she will definitely show and talks about these kind of things. Minor things, but expensive. It should be expensive. The shower, I think the mother said, was 10,000 rupees. 10,000 only for shower in her bathroom. All these kind of minor things. And it should be of show off. It's kind of show off. That is vanity. On the basis of this, I have given her Veratrum for her allergic complaints. Within a matter of 15 days, I think 15 days or 1 month, completely the patient got better. On the basis of this, only this rubric, vanity. Veratrum I have prescribed her. And talks about high of himself. What it is? Talks about high of himself. That is called as boaster, braggart. The remedy is lycopodium, platina, and sulfur. There will be no stuff inside the person, but always he speaks about himself in a very highly manner. He is a boaster. Students not waking from seat on seeing teacher or elder. This we can observe in bus transport. When we go in a city bus or in a train, students will be sitting, or elderly, if the elderly comes, they will not leave the seat to sit. Or if the own teacher comes also, they will not stand up. That is insolent. This is very important in taking a student's case. Insolent, lack of respect. The remedies are platina, sulfur, lycopodium, naxphamica, and veratrum. Always postponing the work. This is also very important. If the patient comes to you and says, sir, I'm trying to come to your clinic since 2 months, 3 months, sir. I was not able to come to your clinic, sir. Definitely one of the patient we have experienced in our clinics. Somebody has referred you, sir. I have heard about you a lot, but I'm trying to come to your clinic, sir. Since 3 months, I was not able to come, sir. Always postponing the work. That is called as procrastinate. Procrastinate. This is a very beautiful rubric. Lycopodium is a drug. Lycopodium carcinosin silicea. On the basis of this rubric, I have cleared a case of PCOS. Procrastinate. Always he used to tell the patient's mother used to complain. If I ask something to do a work in the home, she'll say, Mama, I'll do it tomorrow. Ask her to study also. I'll do it in the night, or I'll do it tomorrow or day after tomorrow. You please bring some materials from the provision store. No, Mama, I'll bring tomorrow. Always postponing work. On the basis of this, I have given lycopodium to a patient. The PCOS got cleared according to the other symptoms. Procrastinate. And grown up behaves like a child. What this is called as? It's a very interesting topic. Childish behavior. We also got lot of remedy for this. Always talks about sex. What it is? It is amorous. Ammonium, lachesis, cannabis, medorinum, naxphamica, opium, platinum, stephisagria. Always talks about sex. For this rubrics, I do remember a case, especially basically he was a teacher, one male patient, aged around 40-45. He used to come to the clinic only to talk this matter only. Always talks about sex. Sir, I was not at all satisfied, sir. Sir. This happens, sir. That happens, sir. No problem, no other problems at all. When you come to my clinic, he always talks about this. I thought of this rubric. It is amorous. So all the remedies. She cannot say no to anybody. What is this? This is yielding. It's a very wonderful rubric. She cannot say to no to anybody. Whatever you say, she'll obey. Yes, that is Barretacar, Gelsinium, Lycopodium, Silicea, and Pulsatilla. Barretacar and Silicea is more marked. Moral corruption. What is this? Moral corruption. Depravity. What it is? Depravity. Now it's an election time in Karnataka here. It's moral corruptions. We are seeing leaders, moral corrupted leaders. Depravity. Anacardium, before opium. And imposing discipline on others, not following himself. This is also very much seen in the political leaders. Imposing discipline on others, not following himself. No, he is not at all to him. Only he can impose some discipline to others. Hypocrisy. That is hypocrisy. Lycopodium, Pulsatilla, Silicea, and sulfur. Always making defaming statement against others. This is again a political view. Slander disposition. 2. Always making some or the other defaming statement. That is slander disposition. That is Veratrum is the major remedy. Adding or skipping of words while reading. This is also very, very important in children's case. That is mind mistakes, reading, writing.
Excuse me, but you
Sir.
are again making bit hurry.
Oh, okay, sir. Okay.
Kindly go slow.
Okay. Fine. Adding or skipping words of while reading. That is mind mistakes while reading and writing. You can ask this question to a children that if the parent says he always makes a mistake and always he used to rub. Once he writes in a page, he rubs. He rubs and writes again. He rubs and writes again. The same word. That is mind, mistakes, reading, writing. These are all the major remedies. Lycosis, Tuja, Merxol, Nattermir. So all the small observations. It's very, very important while taking a case. And patient constantly changing a doctor. This is also very, very important. These are all we have experienced in our clinics. If you ask some patient, they'll come to you, they say, sir, I have been to a number of doctors. Nobody has cured my problem. Constantly changing doctor. If you ask them, well, how much ever time you took the treatment with the doctor, says, sir, 2 days. Sir, only 3 days, no result. Sir, only 1 day, sir, not at all benefited from the medicine, sir. Constantly changing, patient constantly changing the doctor. This you can consider as a rubric. Friends, this also, when we not find the right rubric for this case, and it will be another doctor for the patient like other doctor. They'll change again. They'll go to another doctor. Inconstancy. Ignitia, Belladonna, Brania, China, Calibrom, Pulsatilla, Rustox. So all the main remedies. This is also very, very important. When the patient comes to change the doctors and patient sticking to doctor, even they refer to the doctors. When you say, no, I'm not able to treat you for the further condition, please, I'm referring to another doctor, please go there and you can take the treatment. They say, no, sir, you should only treat me. You have to give the medicine. I have come from that patient, sir. You have cured that patient, sir. I will not go anywhere, sir. Please, sir, please help me, sir. So this is called as faith, firmness. You can think of ferment, ferrum metallicum, as an iron. As an iron, they'll stick to you. They'll not change a doctor. Recently, I have experienced this. On rheumatoid arthritis case, I have treated her long back. I think 2 years back, I have treated her. The patient got married and she has married to Coimbatore. She has gone there. She has taken some medicine there. She has not benefited. And again, she came back to me and I said, I have treated you last 2 years back. There was no positive result. You can please go and opt there itself only. You can take the patient said, no, sir. No, sir. Some Shioma has referred me here, sir. We have cured the patient Shioma's case. So I'll have faith in you, sir. You only have to treat my case and you only resolve my case, sir. Please, sir, I have belief in you, sir. You should only treat me, sir. This I have experienced recently, few months back. That is faith, firmness, ferrum metallicum. You can also think of that. This is also a very, very interesting thing. I will bring more patients if you cure me. This, this kind of rubric will come very instantly and very commonly. This kind of thing I will get in my clinic 5 to 6 patients in a week. I'll bring more patients, sir, if you cure my osteoarthritis, sir. All age persons will tell you after 65 plus, 70 plus patients. Sir, I have got this knee pain, sir. So since 15 years, sir. If you cure me, sir, there are a lot of patients like this, sir. I'll get them to your clinic, sir. What it is? It is bargaining. The rubric is bargaining. Arsenicum, pulsatilla, silicea, bryonia. On the basis of this, I have prescribed bryonia. Lot of cases, especially in osteoarthritis cases. It has got some result. Bryonia, bargaining. And this one, homeopathy need more time to cure, sir. Not suitable in acute cases. This we have encountered. Lot of people will say this when you come, when they come for the first time. I think homeopathy needs more time, no, sir? And it is not suitable in emergency cases, acute cases. This is there is a rubric that is repulsive, blaming. They are blaming our system. That is chamomilla, Marxol, pulsatilla. Another thing is, patient is satisfied despite of various problems and financial worries. What it is, this will get in our clinic. Also, we can also retrospectively we can think of in their occupational environment. Despite of having so much of problems, so much of pressures, so much of targets in their office, in their workplace, they'll say, it's okay, sir, I'm satisfied. Having a lot of various problems in our workplace. And also, the salary will be not satisfied. He also says, not satisfied with the salary, sir. There is no hike at all after doing so much of service in the office. Also, they are satisfied with the work. What it is contented. The rubric is contented. Borax, capsicum, cicuta, opium are the major remedies which comes called as contented. Stress. Nowadays, this has become more. Each and every patient says, sir, I'm having so much of stress, sir. Can we convert it to rubric in our repertoire? Yes. There is a specific rubric, especially in complete repertoire, stressed mentally and emotionally, especially in software engineers. Lot of stress, sir, in our office. That is carcinosin, coca, naxomica, tuberculinum. And also sensitive to opinion of others. That is indignation. And also there is humiliation. The other word is humiliation. That is indignation or mortification, humiliation, sensitive to opinion of others. Very small opinion. They become sensitive to it.
Excuse me, Dr. Gurukiran. I think we can be more sensitive to opinion of others now, and it's time to go to discussion.
Yeah, sir. I'll finish this slide, sir.
Yes.
Yes, okay. And the patient asks, after getting the treatment, sir, have you prescribed the same remedy again? Sir, please make a change of the remedy, sir. Though I'm having relief, please change the remedy, sir. What it is? Change desire for. You can think of rubric change desire. Bryonia, calcareous, hepar, merc, pulsatilla, sanicuda, tuberculinum. Severe pain. Everything is severe. We know that this problem would not cause this kind of severity as a doctor. But patient complains of, sir, severe pain, sir. Everything is severe, sir. It is exaggerating. The patient is exaggerating. There is a rubric. Asafoetida, chamomilla, nux moscata, plumbum, lycopodium, platinum. I have every disease. Whatever disease you say, I have. The patient complains from the head till the toe. I have every disease. What it is? delusion, disease, every disease he has. Aurum mur and stramonium. So these are all some of the rubrics what I have shown you today. There are a lot of
Yes.
other things. I think 1, 2, 3, 4, 5, 6, still 7 slides. Okay, no problem.
Yes, of
Thank
course,
you.
it's a very important session. Think we can continue in the a few days back after that.
Yes, sir.
Continuous 4 or 5 days series, if you are ready, then definitely that will be more beneficial to our participants.
Yes, sir. I think the interaction session will be more interesting, sir.
Yes, of course, we can have
Ceremony, so which will
interactive.
be a
Yes,
very
of
great
course.
learning session.
No, I am telling about the continuation of the program. We can arrange after 1,000-day program for
Yes,
5 days series of presentation from you on this. This is a very important topic, I think.
yes, sir. Yes, sir.
Social
Let us take up a
So
message, sir.
it's time for discussion. Those who would like to have some interactions with our Dr. Gurukiran, it's time to raise your hand. I think a lot of persons participate already put their doubts in the chat box. Shall read it. Mesophobia medicine, which repertory gave medicine in this Medorna in this rubric.
Complete repertory.
Yes, okay. Then another one is squandering money.
Yes, sir. Squandering, sir. Squander.
Yes.
Desire.
Yes.
Yes, sir. Also, you can also think of money also. I would like to present that slide also.
Okay.
Slander disposition to. Or squandering. Yes, it is something. Okay. Anything, sir? Any other questions, sir?
Yes. Then the procrastinate.
Procrastinate, sir. Yes, sir.
Then one is bargaining. These are not questions, but then complete dynamic which edition?
Sir, pardon, sir. Complete?
Complete dynamic which edition? What is that? It's Dr. Sachin Kurlakar. What is that? Complete dynamic.
I think question is incomplete. What
Yes,
does it mean? Complete which edition? I
don't
can't
know.
understand that.
Kindly raise your hand so that we can have an interaction with Dr. Gurukiran. Very important session. Don't try for the chat box channel, I think. Anyway, it's a nice presentation because it needs a lot of effort and have some lot of imagination. Yes, now, Mr. Taciturn, Larry, sir, please unmute and ask. Welcome after a gap. Yes.
Good evening.
Yes, please.
First, thank you very much for this good subject. I think at the end there was a slide which shows from which books we can obtain such information. Can you show it again?
Yes, definitely, sir. I have given the further readings also. I'll show it. Shall I share it, sir?
Yeah, this one.
Yeah.
Yes, okay.
Further
Is there
reading.
any other references about this subject?
Pardon, sir. I didn't get you.
Is there any other advice books about mastering about these words and meanings?
Sir. Definitely, sir. There are a lot of books. What I have mentioned here is Art of Repertorization by Dr. Gaikwad. It's a very good book.
Yeah,
and
it is
Decoding
written
Mental
there.
Rubrics.
Yeah.
By Dr. Gaikwad also. And Rubric of Clinical Conditions by Dr. Mansoor Ali.
Good.
And Miasmatic Rubric Want by Dr. Lalita.
Okay. Thank you very much.
Thank you.
Yes, that was Taciturn, Larry, okay. Now, Dr. Hariharan, sir. Yes, please.
This is the book, The Art of Repertorization by Dr. Gaikwad.
Yes. Hariharan, sir, please.
This is Decoding Mental Rubrics.
Yes, definitely Hariharan sir will be very much happy this time. Sir, please.
Dr. Gurukiran.
Sir, yes, sir.
Okay. Namaste, doctor.
Namaste, sir.
Namaste, namaste.
If
See,
you can,
doctor,
if you can please open your camera so that we can see you.
I am in civil dress. So please. I am in civil dress because I went to see the funeral of funeral and I came here now. So that is what I see. Smash things when due to he will smash things in slightest offense.
Well, this can be seen in almost all homes. Smashing things.
Smashing things.
Yes, like in English
slightest
earlier.
offense.
Yes.
Huh. Sir, I'm not able to hear you, sir.
Okay, I will call you. I will call you then.
Yes, sir.
I will call you. Please put the chat box your number. Then I can
Yes,
write it and directly I will ask. A lot of questions I want to ask, but
Okay.
the time is very limited. No, a lot of questions. A lot of questions.
Yes, Dr. Gurukiran number is there. 9945141298. 99.
Manoj, you are also
Yes.
in speed. You are also in speed. Let
Yes, sir.
let me slow.
994545
Okay.
14
Okay.
1298. Okay.
Okay. Okay.
Yes.
See once again 9945141298.
Yes, sir.
Yes, sir. In the chat box
Okay.
we can see. Okay. Yes.
Okay.
Thank
Okay.
you.
I'll call you. I will call you.
Yes. Yes. One side is quick, other side is slow. What happens? The distance will. Yes, Salim Kumar sir, please unmute.
Sir, it is a very wonderful class. Sir, can you show me the last but one slide?
Which one, sir?
Last but one.
The rubric conversion, sir, or the takeaway message, sir?
Just before the stress, that slide.
Okay, sir. 1 second. This one only, sir.
Okay, sir. Let me take the screenshot. Okay.
Yeah.
Sir, is this your book? I just 15 minutes before I entered this class. Is this
Okay.
book?
No, sir, it's not my book, sir. I've gathered knowledge from other stalwarts.
No. They're showing that black book converting rubric. It is. Is it?
Pardon, sir?
Is it a book?
Okay.
I
No,
see.
sir. I've gathered a lot of knowledge from 3 to 4 books, sir. Not only single book. I have gathered a lot of knowledge from reading 3 to 4 books. What I have shown in the last slide, sir, in the takeaway message, there is a bibliography.
Okay.
These are all the books for the further reading.
Okay, sir. Very wonderful class.
Yes, sir. Thank you. Thank you.
Yeah, these
Yes.
type of classes definitely raise our standard. Okay.
Yes, sir. Yes, sir. This is a very,
So-
very, very important thing, sir.
Yes,
Yes. Okay. Not only classes, but regular participation is also raise the standards now. Yes. Dr. Benazir. Yes, you can unmute now. Dr. Benazir. Yes, please. You can unmute now. Yeah. Dr. Benazir, please.
Hello.
Yeah, please.
Hello, doctor, your session can only hear from last part only, but it was great. Actually, I had one doubt. Can you tell me, help with me?
Yes, sir. Yes, madam. Yeah, tell me.
Actually, I got one patient last day and she had a strange type of symptom. She told that when she saw her husband putting one SIM into the phone, no, she is feeling a choking like sensation, like her breath is on hold. She cannot breathe out. Even when she was seeing her daughter's stapled book cover, she gets a special type of feeling that she's not getting air hunger. She's not getting that air, that she cannot expel that air out, and she is consciously making, like what we say, consciously breathing out. And then she somehow want to keep that away from the mind. She may go out in the balcony or then think something else. For half an hour, she's telling that if she stays in that room, she will get suffocated. So how
Yes.
can I
Yes,
take
there is a rubric
Please,
is called
please
as
wait. Yes.
there is a rubric called as choking or constricting. Especially, you have to ask where the sensation is sensed in the patient's body, in the throat, or in the mind, or in any parts of the body. It is also very, very important. For this,
she's like she's telling that maybe because she is having a thyroid nodule, is that the issue? Thyroid pressing, and she is causing this thing. So I think it is mainly in the throat. She is having that feeling.
There is a rubric in a complete repertory: throat, choking, or constricting.
Okay.
Go through it.
Yes.
Okay.
Okay. Now, Dr. Sachin. Yes. Dr. Sachin, please unmute. Yes.
Yes, sir. Very good session by Dr. Guru, sir.
Thank you, sir.
I am asking the first question, sir. Which complete repertory, complete dynamic, which edition you can use? Complete browser, complete dynamic, which edition?
Yes, I'm using Zomeo. Homeopathy.
Zoomio.
3.0. Yeah, 3.0. The version is 3.0.
Okay.
You have got the complete updated repertory.
Okay.
Yeah.
Faith, firmness. One single rubric you can take it. Faith, firmness, and only one medicine, Ferrum-Med. Which doctor can add this medicine?
Pardon? Which?
Which doctor can add this medicine, faith, firmness? Because sir, मुझे क्या पूछना है कि देखो कंप्लीट रेपर्टरी ब्राउजर एडिशन मेरे पास है, ये रूब्रिक वहां पे नहीं है. एज ए कंपेयर मैं रडार ऑप्स लेटेस्ट यूज कर रहा हूँ, उसमें भी फेथ ये रूब्रिक अलग है और फर्मनेस इज डिफरेंट. यानी दोनों रूब्रिक डिफरेंट है. फेथ रूब्रिक डिफरेंट है, फर्मनेस रूब्रिक डिफरेंट है. हाउ मच you can join, anything, any proof? कहाँ से लिया सर आपने?
I have explained the case for that rubric. The patient will firmly stick on to you. Whatever you say, whatever you refer to the patient, they will not obey. They'll firmly stick on blindly with you. That is firmness, faith in you.
Okay. Yes. Okay. Now, Parisa, you can have your comments as well as down. You can clear your doubts as well as express lot of thanks. Sir, please. Parisa.
Okay. Dr. Gurukiran.
Sir.
Good evening.
Good evening, sir.
Very interesting topic, no doubt about that. I have enjoyed it because the politicians are the main way for recruitment. I think we had to read all the politicians. It's a surprising information that all the behavior and character can be treated under homeopathy.
Yes,
that's a very interesting thing. I don't think any other system of medicine can deal these things. I request you to have a detailed discussion on this, as you pointed out that the question answer systems around that, and it will give a more clear picture for people like me who are not I am not a homeopath, but very interesting. On behalf of our noble forum, each members of this forum may express attitude of gratitude to you for making it very interesting and impressing and talented presentation on this. Thank you very much. All the best. Thank you.
Thank you, sir. Thank you very much.
Yes, definitely. IFPH is very instrumental to promoting these young talented persons and improve the quality of homeopathy throughout the world. Definitely, we will arrange a series of classes from Dr. Gurukiran so that everybody will be benefited and he will be forced to make more references also. That's also very important. With that remarks, let me conclude today's English session. Hope you to meet the same day tomorrow. Till then, goodbye. And it is all Dr. A.R. Ashok Kumar to continue the program in Malayalam.